Welcome to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri, and today we are diving into a topic that's as intricate as the immune system itself: fibrosis after COVID-19, and specifically how Anakinra might play a role in preventing or managing this. COVID-19's immediate effects are well known, but as more people recover, long-term complications like fibrosis, where tissues become scarred and stiff, are starting to become a significant concern. To help us unravel this, I'm joined by Aseema, a microbiology researcher with an interest in fibrosis and inflammation. Aseema, welcome.
Thank you so much for having me, Gaganasri. I'm really excited to discuss this topic, and especially given how widespread post COVID complications like fibrosis have become.
Absolutely. It's a growing concern.
Yeah.
Let's start from the beginning. Fibrosis can be a bit of mystery for many. What exactly is fibrosis and why should people recovering from COVID-19 be particularly worried about?
Well, fibrosis is basically the process in which normal tissue is replaced by scar tissue. And this happens when inflammation or injury causes the body to attempt repair, but the repair mechanism goes a bit overboard. Instead of restoring the tissue to its original state as expected, the body instead creates excess fibrous tissue that is stiffer and non functional. And for COVID 19 survivors, especially those who had severe illness or prolonged symptoms, inflammation doesn't always subside after the infection. And this chronic inflammation can eventually lead to fibrosis in vital organs like the lungs, heart, and even kidneys. And the problem with fibrosis is that it impairs the normal function of these organs, making recovery much more difficult and sometimes even irreversible.
That sounds really troubling,
Yeah.
especially considering the number of people dealing with long-term symptoms. So, where does Anakinra fit into this puzzle? How can this drug help prevent or reduce fibrosis in post-COVID patients, Aseema?
So Anakinra is an IL-1 receptor antagonist, meaning it blocks the activity of IL-1, which is a key inflammatory cytokine. And in diseases like rheumatoid arthritis, chronic inflammation drives tissue damage, and Anakinra has shown to help reduce that damage in those cases. Also, in the case of fibrosis, the idea is that by blocking IL-1 early in the inflammatory process, Anakinra can prevent the body from overcompensating and forming excess scar tissue. So, by targeting the root cause of fibrosis, ongoing inflammation, Anakinra might help prevent fibrosis from developing in post-COVID patients, especially in their lungs, where fibrosis is, most common.
So, Anakinra essentially works as a brake on the inflammatory process, helping to stop it before it leads to permanent damage.
Yeah.
Are there any studies looking at how Anakinra could help with fibrosis in COVID-19 patients?
Yes, there's an increasing interest in this area at the moment. While most of the studies so far have focused on anakinra's role in the acute phase of COVID 19, some research is starting to look at how it could affect fibrosis in patients recovering from the virus. For example, there's evidence from animal models and studies in other inflammatory diseases showing that IL-1 plays a critical role in fibrosis. In preclinical models pulmonary fibrosis, anakinra has been shown to reduce the formation of fibrotic tissue, which has led to researchers to consider its potential in COVID, uh, in post-COVID fibrosis, particularly in the lung.
What are some of the challenges in translating this from the lab to real world clinical practice?
Well, fibrosis is a complex and multifaceted process. It's not just about one cytokine like IL-1. Other inflammatory cytokines, fibroblasts, and extracellular matrix proteins also play a role in how the fibrosis develops. So, while Anakinra targets one important piece of the puzzle, we may need other therapies alongside it to fully address the condition. And another challenge is also that fibrosis in COVID 19 survivors is still a relatively new area of research. Most studies have been focused on the acute disease, so we don't yet fully understand how fibrosis develops in these patients. Long-term studies are essential to see if Anakinra can prevent or slow the progression of fibrosis over time.
So it sounds like we have just scratched the surface of this issue, but the potential is definitely there.
Yeah.
Looking ahead, what do you think the next steps are for researchers exploring Anakinra in the context of post-COVID fibrosis?
Well, the next big step is to initiate larger and more focused clinical trials that specifically examine anakinra's effects on patients at risk for developing fibrosis. Researchers also need to identify which patients would benefit the most, the optimal timing for treatment, and the best dosage as well. It's also crucial to track patients over a long period of time to understand how anakinra could prevent or slow fibrosis. In addition, because fibrosis is such a complex condition, we may need to explore combination therapies as well. Anakinra could be used alongside other treatments that target different aspects of the fibrotic process, ultimately improving patient outcomes.
It seems like we are headed in the right direction, but there's still a lot of work to be done. Thank you so much, Aseema, for sharing your knowledge and insights on Anakinra and its potential to help manage post-COVID fibrosis.
Thank you so much, Gaganasri. It was a real pleasure discussing this important topic, and I'm excited to see how the research evolves in the future.
In our next episode, we'll shift gears to explore how immune pathways, especially those involving IL-1, interact with metabolism during and after COVID-19. What does this mean for patients with lingering symptoms, and where does Anakinra fit into the picture? We'll dive into these details in the next episode. And to our listeners, thank you for joining us for this episode of Blocking the Flame, Anakinra and COVID. Be sure to consult your healthcare provider for personalized advice. Stay tuned for more episodes.